Chronic gastritis is a condition characterized by inflammation of the stomach lining that persists over time. The causes can be broadly categorized into several key areas. 1. Helicobacter pylori infection. Cause: infection with the bacterium Helicobacter pylori, H. pylori, is one of the most common causes of chronic gastritis worldwide. This bacterium can colonize the gastric mucosa and lead to chronic inflammation. Mechanism: H. pylori produces urease, which neutralizes stomach acid, allowing the bacteria to survive. The infection leads to the production of cytokines and inflammatory mediators that damage the gastric lining. 2. Long-term use of non-steroidal anti-inflammatory drugs, NSAIDs. Cause: prolonged use of NSAIDs, such as aspirin, ibuprofen, and naproxen, can irritate the stomach lining and lead to chronic gastritis. Mechanism: NSAIDs inhibit the enzyme cyclooxygenase, COX, reducing the production of protective prostaglandins in the stomach lining. This makes the mucosa more susceptible to acid damage. 3. Autoimmune gastritis. Cause: in autoimmune gastritis, the body's immune system mistakenly attacks the healthy cells in the stomach lining, particularly parietal cells that produce intrinsic factor and hydrochloric acid. Mechanism: this autoimmune response leads to atrophy of the gastric mucosa and can result in vitamin B12 deficiency due to the lack of intrinsic factor. 4. Chronic stress and lifestyle factors. Cause: while stress itself does not directly cause chronic gastritis, it can exacerbate existing conditions. Lifestyle factors such as excessive alcohol consumption, smoking, and a diet high in spicy or acidic foods can also contribute. Mechanism: these factors can impair the protective mechanisms of the gastric mucosa and increase acid production or reduce the protective mucus barrier. 5. Bile reflux. Cause: bile reflux, where bile flows upward from the small intestine into the stomach, can irritate the stomach lining and lead to chronic gastritis. Mechanism: bile acids can disrupt the gastric mucosal barrier, leading to inflammation and damage. 6. Infections other than H. pylori. Cause: other infections such as viral, for example, cytomegalovirus, or fungal infections can cause gastritis in immunocompromised individuals. Mechanism: these pathogens can directly invade the gastric mucosa and induce an inflammatory response. 7. Other causes. Cause: certain conditions like Crohn's disease, sarcoidosis, and graft versus host disease can also lead to chronic gastritis. Mechanism: these conditions often involve systemic inflammation that can affect the stomach lining. Symptoms: the symptoms of chronic gastritis can include upper abdominal pain or discomfort, nausea and vomiting, bloating and gas, loss of appetite, weight loss, morphology. Chronic gastritis is characterized by chronic inflammation of the gastric mucosa, leading to morphological changes in the stomach lining. Here's a detailed overview of the morphological changes. At 1. Mucosal inflammation. Chronic inflammatory cell infiltrate. The lamina propria of the gastric mucosa is infiltrated by chronic inflammatory cells, primarily lymphocytes, plasma cells, and sometimes eosinophils and neutrophils. Lymphoid aggregates or follicles. In some cases, lymphoid aggregates or follicles may form in the mucosa, indicative of a chronic immune response. 2. Glandular atrophy. Loss of gastric glands. Prolonged inflammation can lead to atrophy of the gastric glands, reducing the number of parietal and chief cells. This results in decreased acid and enzyme production. Metaplastic changes. Intestinal metaplasia, replacement of gastric epithelium with intestinal type epithelium, or pseudopyloric metaplasia, replacement with pyloric gland type mucosa, may occur as a response to chronic injury. 3. Mucosal damage and regeneration. Foveolar hyperplasia, the surface epithelium and foveolar pit region may show hyperplastic changes with elongated pits and regenerative epithelium. Mucosal erosions. In severe cases, chronic gastritis can lead to mucosal erosions, which are superficial defects in the mucosa. 4. Histological features. Inflammatory cell infiltration. The presence of chronic inflammatory cells in the lamina propria is a hallmark. Goblet cells in intestinal metaplasia. If intestinal metaplasia is present, goblet cells may be seen in the gastric mucosa. Dysplastic changes. In long-standing cases, especially with H. pylori infection or autoimmune gastritis, dysplastic changes may occur, increasing the risk of gastric cancer. 5. Types of chronic gastritis based on morphology. Non-atrophic chronic gastritis, characterized by inflammation without significant glandular atrophy, often associated with H. pylori infection. Atrophic chronic gastritis features glandular atrophy and metaplastic changes. This type is associated with a higher risk of gastric cancer. 6. Special stains and markers. Giemsa or Genta. Diagnosis. Diagnosis typically involves endoscopy to examine the stomach lining and take biopsies. Tests for H. pylori, such as breath tests, stool tests, or biopsy tests. Blood tests to check for anemia or vitamin deficiencies. Treatment. Treatment depends on the cause. For H. pylori, antibiotics and acid-suppressing medications. For NSAID-induced gastritis, discontinuing NSAIDs and using proton pump inhibitors, PPIs, or H2 blockers. For autoimmune gastritis, vitamin B, 12 injections, and management of symptoms. Understanding the specific cause of chronic gastritis is crucial for effective treatment and management. If you suspect you have gastritis, it's essential to consult a healthcare provider for a proper diagnosis and treatment plan. Chronic gastritis can lead to several complications if left untreated or poorly managed. Some potential complications include implication. 1. Gastric ulcers. Chronic inflammation can lead to the development of gastric ulcers, which are open sores in the stomach lining. 2. Gastric atrophy. Prolonged inflammation can cause the stomach lining to thin and lose its glandular cells, leading to reduced acid and enzyme production. 3. Intestinal metaplasia, a condition where the stomach lining is replaced by cells resembling those found in the intestine, which can increase the risk of gastric cancer. 4. Dysplasia, abnormal cell growth in the stomach lining, which can be a precursor to gastric cancer. 5. Gastric cancer. Chronic gastritis, especially when caused by H. pylori infection or autoimmune gastritis, can increase the risk of developing gastric cancer. 6. Malabsorption. Reduced stomach acid and enzyme production can impair nutrient absorption, leading to deficiencies. 7. Anemia. Chronic gastritis can lead to vitamin B12 deficiency anemia due to impaired intrinsic factor production. 8. Bleeding. Gastric ulcers or erosions can cause bleeding, leading to hematemesis, vomiting, blood, or melena, black tarry stools. 9. Perforation. Rarely, gastric ulcers can perforate the stomach wall, leading to peritonitis and potentially life-threatening complications.